Hi everybody, thank you for joining us. I'm Larry Little. This morning we are continuing our conversation about school reopenings. David Putney from the Santa Clara County Office of Education is here, and in just a few moments we will be discussing some of the questions that some of our community members have regarding school reopenings here in Santa Clara County. But first, we want to let you know that prior to this broadcast, we did remove our face coverings, so everyone, including the American Sign Language interpreters, can clearly understand the information and properly communicate that we will be sharing this morning. David, thanks for being here. You're back so soon.
Well, my pleasure.
You know, things are constantly changing with COVID here. So, you know, it's great that schools are, reopening for in-person instruction. And, we've been receiving a lot of telephone calls as well as questions coming in via Messenger regarding temperature checks and what the process is for schools, what they should be doing. So is there an actual process, and just tell us, what should schools be doing?
Great question. Thank you, Larry. We originally started with temperature checks early on when we were learning about COVID, and we felt that that was the most effective early on. The public health department has clarified that the use of temperature checks is not as effective and as necessary in the school setting. So what we've developed now is more clear guidelines on what is accepted at the schools. And it's really about the personal screening that the faculty does before school, the parents and the children before they come to school. And it's clearly outlined if they have symptoms of a fever over 100.04 temperature, if they have any additional symptoms, and there's a screening. Each school is providing that screening sheet to students and to parents and also to staff, so they can do that self-reporting before they come in. It's more effective, and it also helps empower, I think, everyone to be part of the solution with COVID-19.
It's very similar to a lot of the checks that we go through coming here to the Emergency Operations Center.
Yeah, exactly. And I think the more effective things that the schools are really doing is really developing the use of the face coverings. I know we're not wearing the face coverings right now because of the reasons you stated, but the face covering is the most effective thing that everyone can do to prevent COVID-19. The other thing schools are doing a fantastic job about is also helping ensure that people understand the hand washing and the hygiene that's really necessary to prevent that. So you're not touching your eyes, you're not touching your nose, you're washing your hands regularly, long enough to really decrease any potential infection. The schools are going through their regular cleaning, consistent protocols to make sure that surfaces are cleaned, high-touched areas such as door handles, tabletops, workspaces is cleaned on a regular basis. And around here at the EOC, we're cleaning our own workspace every day, at the beginning and also at the end of the day. So I see this as a chance for everyone to take more ownership in keeping their environments clean. And schools are really helping that. And they're also looking at the food distribution when they do provide food to make sure, again, it's very clean, it's cleaned on the front end, and provided using personal protective equipment regularly.
Yeah, another thing that we're doing here that everyone should be doing, we're getting tested on a regular basis.
Yes, we are.
Okay. So the cohort question continues to come up. Can you explain what a stable cohort is and what it means for schools? Is it different based on elementary, junior high, high school?
Great. The cohort is really established to keep that social bubble around the individuals at the school setting. So the elementary level, it's really expected that the students would be in their small classroom environment, they'd be maintaining their 6 feet social distancing, and then that one cohort would be how they would have their school in-person instruction. That means that when they go to a lunch environment, they're supported by their staff member that also is part of that stable cohort, and that they actually then go to their recess time, they're able to play outdoors, but then they come back in the school setting and they're in that one stable cohort. The middle and the high school, as schools reopen, it becomes a little bit more difficult because historically students have gone between classes and multiple classes. So we're working with schools to try to minimize that and to look at how they can prevent a lot of crossing of students. So again, less changes in the school day is the best. The stable cohort, being a small group of students that stays together with their teacher, is the best. And then for the after school and before school, the same idea applies, is that they should have one small stable cohort that they would be for an after school program. So at the end of the day, a student would be in 2 social bubbles, one at school, one for their after-school care, and then they'd go back home to their families.
So how are schools handling, choir and band and activities like that?
That's a great question, especially at the high school. Students have so many activities in choir and band. The activities that are creating the aerosol, the wind instruments, the trumpets or the trombones, or the choir singing, that can create a lot of aerosol, which we've found through science is that's where COVID potentially can be transmitted. So the guidelines are not allowing those types of activities to occur right now in the school setting for those obvious reasons. Schools can still have band, they just need to not have the aerosol producing activities. So if they want to be practicing their drums and they could do other instruments that are that are non-aerosol creating, they can do that and practice social distancing. I know some schools have explored having marching band outside with a 6 feet social distancing. It's a great example. Some have been wanting to do drama productions. I think that's something we need to continue to support schools on working that through. As long as they're not singing and creating the aerosol, as long as they're social distancing, and hopefully outside would be the best case scenario to allow that.
So as this virus continues to evolve, there are changes with everything, such as information. How can community members continue to get their questions answered?
Great question. The evolution, we continue to improve our messaging and improve the science explanation as we go forward. When questions come up, we encourage that the families work directly with their schools to ask the question. They know the school, they know the staff know them, the staff know their children. It's a great first start to ask their questions and resolve that. If the school doesn't have the information because it's new science or new conditions, please reach out to us here through the main county page. There's an area where you can ask your questions. If there's, again, information that we know, we'll report that out. If sometimes there's questions we don't know the answer, we'll bring it back to Public Health Department and they'll help clarify that for us. Public Health is doing a fantastic job of making the science understandable and making the practice, informing the practice so we improve our practice together.
Yeah, so we don't plan on going back to purple.
Right.
But how complicated will it be once we move to a different tier? Will there be less restrictions and it be a lot easier for the schools?
Larry, that question, I think we'll have to address that over the course of the coming weeks, and we'll follow Public Health Department's directives. I anticipate that the protocols that we've established will continue because they make sense. They're based on science. Face coverings, proper hygiene, cleaning, social distancing, stable cohorts. I would anticipate that those practices are what's helping us stay in Tier 2 and helping us move towards Tier 3. I'd anticipate that those common practices will continue because they're working and they make sense.
So a little bit of discussion around, people hear school reopening and they feel that every school is opening their doors. Can you explain how each school is operating or going about this process? Absolutely.
Here in California, we have local control. The way the Constitution has addressed the responsibilities of public education and private education is it's local control. So local school districts are governed by their local districts and their local elected officers. Private schools have their own governance board, and charter schools are also governed through their chartering district. Each of those local education agencies, as we call them, often LEA, is having to make the decisions on what's best for their community with their colleagues, with their collective employment groups, and to see how they can respond. So when students and families are curious on where their school is, we encourage you to reach out to the school and ask them directly. Some schools are able to move faster through that process due to their size. And some districts are working through some additional requirements that they need to work through to provide a safe and consistent school environment. So it's not that all schools are open, it's all individualized based on the different school community.
A lot of times people are sitting out there and they're wondering, who is this person giving me all this information? So I'm putting you on the spot for just a little bit. Talk about some of your credentials in working in education.
Oh, great. That's very kind of you. I've been in public education for now 25 years as a classroom teacher, as a special education teacher, as well as a school site administrator, administrating alternative schools, independent study schools, traditional comprehensive high schools, and also currently at the County Office of Education, currently working under the direction of our county superintendent.
Awesome. And we talked the other day, and you didn't do it for the money. You say your first job paid $20,000.
Yeah, my first teaching assignment. Yes.
And you stayed at it for so many years.
Well, you know, working with children and families is so important. Education is the path of all of us becoming the best that we can be. And I just feel really inspired every day to support schools and staff and kids to be their best. And education, you just keep improving, you keep learning, and this is a perfect example of learning by doing and following the guidelines of our public health department to ensure that everyone's safe.
All right, David, thank you for being here. We'll have you back
My pleasure.
when the information changes, which that could be in a few days.
Thank you so much.
All right, we want to invite you to join us for In Vivo, Facebook Live in Spanish on Mondays and Wednesdays and Friday at 11 a.m. and Facebook Live in Vietnamese on Thursdays at 10 a.m. Air quality is expected to be unhealthy today. Limit your outdoor activities. It's also going to be very warm this week, so you want to just stay inside and stay cool. Also, flu shots. We want to encourage everyone to get a flu shot here in the county. You can go to sccphd.org/flu. Again, sccphd.org/flu. All right, thanks for watching, everyone. Stay cool. We'll see you next time.